If someone you love is over the age of 65, there's something most doctors never tell them. Not because it's a secret, but because it's become so normalized in medicine to prescribe pills that might help one problem while quietly causing 2 or 3 more. And many seniors assume their fatigue, their dizziness, that nighttime confusion, even those falls, they assume it's just aging. But in reality, some of the most commonly prescribed medications are making them weaker, drowsier, more dehydrated, or damaging their kidneys without any obvious symptoms until it's too late. So today, we're not here to attack medicine. We're simply asking a powerful question. If there were safer options, why take drugs that could make aging harder? Let's take a closer look at 5 medicines I would never want a loved one over 65 to be on unless there were absolutely no safer alternative. Now, before we dive in, I want to be very clear. I'm not saying these medications are never indicated. Of course, they have their place in certain situations. But based on my years of experience as a doctor, I've seen countless problems because of these drugs. And I think it's time we talked openly about it. Because no one should ever change or stop a medication on their own without speaking to their doctor. But everyone deserves to know what they're putting into their body and whether the benefits truly outweigh the risks. So let's start with the first one. It's a blood pressure medication that's been around for decades. You might even have it sitting in your medicine cabinet right now. It's called hydrochlorothiazide. Most people just call it HCTZ. And if you're in the United Kingdom, you might know it as benadryl. Either way, it's a diuretic. It's meant to help lower blood pressure by getting rid of excess fluid. Sounds helpful, right? But here's what I've seen happen over and over again in the emergency room. Someone over 65 starts feeling unwell. Maybe they catch a cold, maybe they have a stomach bug, maybe they're just not drinking enough water because they don't feel thirsty. But they keep taking their HCTZ every single day because that's what they've been told to do. And day by day, they get more dehydrated, their potassium levels start to drop, and by the time they come to the hospital, their potassium is dangerously low, sometimes well below the normal range. We're talking levels that can affect the heart, cause muscle weakness, confusion, even collapse. I've seen potassium levels drop to ranges that frankly scare me. And the scary part, the person often doesn't feel it happening. They just feel off, tired, weak, dizzy, and they think, well, I'm getting older, this is just how it is. But it's not. It's the medication. Even when people are feeling fine and getting their labs checked regularly as an outpatient, I'll see their potassium running low. And what's the solution? They're prescribed a potassium supplement or told to eat more bananas, more leafy greens. But why are we treating the side effect of a medication instead of questioning whether that medication is the best choice in the first place? There are so many other blood pressure medications out there, medications that don't strip the body of potassium and water the way HCTZ does. Personally, I wouldn't want any relative of mine, any loved one of mine over the age of 65 to be on this particular drug. So if you're on it, or someone you care about is on it, and you suspect low potassium is an ongoing issue, talk to the doctor, ask if there's a better option. Because here's the thing, dehydration and low potassium can make someone fall, and falls, as we know, can change everything. A broken hip, a head injury, a long recovery that spirals into more problems. But if dehydration can make someone fall, the next medicine we're going to talk about can make it almost impossible to stay awake, let alone stable. Let me ask you something. Have you ever taken a medication and felt like you were walking through a fog? Like your brain was wrapped in cotton? That's what I hear from so many people who've been prescribed gabapentin. It's also known by the brand name Neurontin, and it's commonly prescribed for nerve pain. And look, I understand, nerve pain is real. It's frustrating, it's exhausting, and people are desperate for relief. But here's what I've seen time and time again. Someone comes into the hospital and they're extremely drowsy. Their family is worried. They seem confused, disoriented. And when we look at their medication list, there it is, gabapentin. Often at very high doses, sometimes several hundred milligrams multiple times a day. And the doses keep climbing because over time, people build a tolerance. They need more to get the same effect. It's a cycle. So we cut back on the dose, sometimes significantly. And within a day or two, the person wakes up, their eyes are brighter, they're more alert, they're talking, laughing, engaging with their family. And the family will say, we haven't seen mom like this in months. What happened? And I'll say, we reduced the gabapentin. Now, I'm not saying gabapentin doesn't help with pain. It can. but at what cost? When someone over 65 is drowsy all the time, it's not just uncomfortable, it's dangerous. Drowsiness leads to falls. Falls lead to fractures. Fractures lead to surgeries, hospitalizations, loss of independence. And sometimes it's not aging that's causing the drowsiness, it's the medication. So if you or someone you love is on gabapentin and they seem more tired, more out of it than they used to be, it's worth having a conversation with the doctor. Is this dose still appropriate? Is there a different approach we can try? Because being awake and present, that's not a luxury. That's life. But sedation isn't the only danger lurking in the medicine cabinet. Some medications quietly chip away at organs you can't feel until it's far too late. And one of the most common culprits? Pain relievers. Specifically, a class of drugs we call NSAIDs, non-steroidal anti-inflammatory drugs. You've probably heard of them. Ibuprofen is one. You can buy it over the counter, naproxen, diclofenac, these are stronger versions, often prescribed for conditions like arthritis. And on the surface, they make sense. Arthritis causes inflammation. These drugs reduce inflammation. Problem solved, right? Not exactly, because while these medications can help with pain in the short term, when people take them day after day, week after week, month after month, they can cause serious damage. I've seen people come into the hospital with severe stomach issues, ulcers, bleeding, sometimes even vomiting blood. And when we take their history, they've been on a high-dose NSAID for months, sometimes years, trying to manage chronic pain. The problem is, these drugs can erode the lining of the stomach. They can also quietly damage the kidneys, and the kidneys don't always send out warning signals. You might not feel anything until the damage is significant. So yes, NSAIDs can reduce inflammation, but at what cost? And here's the bigger question. Are we treating the root cause of the inflammation, or are we just masking the symptoms? I always prefer more natural approaches when possible. Physical therapy, movement, dietary changes that reduce inflammation from the inside out. And if medication is necessary, working with a doctor to find the lowest effective dose for the shortest period of time. Because no one over 65 should be on a high-dose NSAID long-term without regular monitoring, and a very good reason. While some medications hurt organs, others simply sedate the brain, even when they're only meant to relax muscles. And that brings us to medication number 4, Flexeril. The chemical name is cyclobenzaprine, and it's prescribed for muscle spasms. Now, muscle spasms are uncomfortable, no question. But in people over 65, Flexeril often acts less like a muscle relaxer and more like a sleeping pill you never asked for. I've seen this scenario more times than I can count. Someone is prescribed Flexeril for a back spasm, a neck strain, something like that, and within days, they're more sedated, more unsteady. Their family notices they're stumbling, moving slower, sleeping more, and then sometimes they fall. A fall leads to a fracture. A fracture leads to surgery. Surgery leads to weeks of recovery, loss of independence, maybe even a stay in a rehab facility, all because of a medication that was supposed to help them feel better. And here's the thing, many muscle spasms have other underlying causes. Low magnesium, for example, is incredibly common and often overlooked. A simple magnesium supplement can sometimes do wonders for muscle cramps and spasms without the sedation, without the risk. So if a doctor is thinking about root causes, instead of just writing a prescription, there are often safer, more effective options. But sedation doesn't only come from muscle drugs. Sometimes it's hiding in something as simple and familiar as an allergy medication. And that brings us to number 5, Benadryl. The chemical name is diphenhydramine, and it's one of the most commonly used antihistamines in the world. People take it for itching, for rashes, for allergies. It's sitting in medicine cabinets everywhere. It feels harmless. But for someone over 65, it can be extremely sedating. I've taken Benadryl myself, and I remember feeling wiped out, foggy, exhausted, unable to concentrate. Now imagine that effect on someone in their 70s or 80s. A pill taken for an itchy rash can lead to hours of brain fog, drowsiness, and unsteadiness. And again, we're back to the same risk: falls, confusion, injuries. The good news? There are non-sedating antihistamines available. They work just as well for allergies and itching, but without the drowsiness. So if you or someone you love needs an antihistamine, Ask the doctor or pharmacist for a non-sedating option. It's a small change that can make a big difference. So those are the 5 medications I'd never want a loved one over 65 to take unless there were no safer alternative. Hydrochlorothiazide, gabapentin, high-dose NSAIDs, Flexeril, and Benadryl. And the real message here isn't to fear medication, it's to respect it. Every pill has benefits and risks. And for seniors, those risks multiply, especially when drowsiness, dehydration, or organ stress could lead to long-term decline. No one should change medications on their own, but everyone deserves a doctor willing to question whether a prescription is helping more than it's hurting. A healthier life after 65 starts with knowledge, with conversations, with alternatives that support the whole body, not just one symptom. Because aging should not mean more pills. It should mean more life. So here's what I want you to do. If you know someone over 65, share this video with them. It could help them ask the right questions and protect their health. And if you want more eye-opening information like this, go ahead and like this video, subscribe to the channel, and tell us in the comments, have you or someone you love had an unexpected reaction to any of these medications? Your stories can help others stay safe. Thank you for watching. Thank you for caring enough to learn. And remember, knowledge is power, especially when it comes to the medications we put into our bodies. Let's keep the conversation going.